There's a condition that 40% of people over 80 have in their bodies right now. Not 40% of sick people, 40% of people, and most of them don't know it. When that condition finally sends them to the hospital, and eventually it does, the mortality rate in the first year is around 35%. A routine blood test won't catch it, a cholesterol panel won't show it, and the symptoms are so ordinary that people brush them off. Today, I'm going to tell you exactly what heart failure is, how to recognize it in yourself or someone in your family, and what you can actually do about it this week. I'm Dr. Dave, and before I get into the science, I want to explain something that genuinely frustrates me professionally. The average medical appointment lasts 10 to 15 minutes. In that time, your doctor has to check your blood pressure, renew your prescriptions, review your cholesterol, and fill out electronic forms. Not because they don't want to do more. The system doesn't leave room for it. So when someone comes in and says, "Doctor, I get tired faster than I used to," the answer they hear is, "That's just age." And sometimes it is age, but sometimes it isn't. I have patients, and I see this regularly in my practice, who show up to the emergency room literally unable to breathe, lungs full of fluid. And when you go back through their history, the signs were there for months, but no one connected them. Heart failure is the leading cause of hospitalization in people over 65 in most of the developed world, not second, first, and yet the decline gets normalized until there's no margin left. Let's start with the real numbers. The incidence of heart failure after age 65 spikes. We're talking more than 10 new cases per 1,000 people per year, based on European and North American epidemiological records. But what exactly is it? I'm going to use an analogy because the medical terminology honestly doesn't help here. Your heart is a pump. Its job is to take oxygenated blood and push it out to all your organs, then pull the used blood back. That's it. Over time, from sustained high blood pressure, from diabetes, from small undiagnosed heart attacks, that pump deteriorates. And here's something most people don't know, including people with some medical background. There are two types of heart failure. In one type, the heart enlarges and loses strength. In the other, the heart becomes stiff and doesn't fill properly. This second type, what we call heart failure with preserved ejection fraction, accounts for nearly 50% of cases in people over 65. The echocardiogram can look normal. That's why it gets missed. That's why it reaches diagnosis late. In both cases, the end result is the same. The pump can't do its job. What happens when a pump fails? Fluid backs up. Blood that should be circulating starts to pool, and then the kidneys do something that makes biological sense, but in this situation makes everything worse. They detect that perfusion pressure has dropped and activate a sodium and water retention response. It's an emergency mechanism designed for when you're losing blood. But here there's no hemorrhage, there's a weak pump, and the kidneys are sending more fluid into a system that can no longer handle it. That excess fluid has to go somewhere. It goes to the legs, to the ankles, to the abdomen, and most critically, to the lungs. That's what we call congestion. That's where the term congestive heart failure comes from. I want to pause here because I think this is important to say out loud. One of the biggest mistakes in how cardiovascular disease is communicated is that people think a heart problem always hurts, that there's chest pain, that it's sharp, it's dramatic. That's how movies show it. But in older adults, especially those with long-standing diabetes, Autonomic neuropathy can damage the nerves that carry that pain signal. The heart can be progressively failing and the patient feels nothing in their chest. They feel other things, things they attribute to age, to tiredness, to the weather. That's not negligence on the patient's part. It's that no one taught them what to look for. That's what I want to change in the next few minutes. I'm not going to give you vague symptoms. I'm going to give you 3 concrete things you can check today. I'm not asking if you get breathless when you run. I'm asking, how many pillows do you need to sleep? Have you started needing 2 or 3, or even sleeping semi-upright in a recliner because lying flat makes you feel like you're suffocating or triggers a dry cough that won't quit? That has a medical name, orthopnea, and it has a direct explanation. When you lie down, gravity stops helping. The fluid that accumulated in your legs during the day redistributes toward your chest. A healthy heart handles that without a problem. A heart with failure can't pump that extra volume, and the fluid filters into the lung tissue. If you've been gradually sleeping more and more upright without really knowing why, that deserves a conversation with your doctor. If your weight goes up quickly and without an obvious reason, overeating for instance, that's not fat. You can't gain a kilogram of tissue in 24 hours. If you're up more than a kilogram in a day or more than 2 kilograms in a week, that's retained fluid. Press your fingers on your shins, right on the bone. Hold for 5 seconds. If the indentation stays when you let go, that's edema. In plain terms, the pressure in your veins is high enough that fluid is leaking out into your tissues. And here's something a lot of people don't connect. If you're waking up multiple times a night to urinate, what's called nocturia, it may be because during the day your kidneys weren't getting enough blood flow, and when you lie down, they finally have a chance to process it. It's not always the prostate or the bladder. This is the one that gets misread the most. Some older adults become more forgetful, slower to respond, more confused in the mornings. The family assumes it's Alzheimer's or cognitive decline. Sometimes it is, but sometimes it's the heart. When the pump fails, the body prioritizes. It sends what little it has to the most critical organs, and if the brain receives chronically reduced blood flow and oxygen, the first symptom can be cognitive, not cardiac. The same happens with muscles. If activities you used to do without thinking, grocery shopping, showering, climbing 4 steps, now require you to sit down and recover, your muscles aren't getting the oxygen they need. It's not just that you're getting older, it's that the flow isn't reaching. If you recognize these signs in yourself or someone close to you, the first step is medical. Ask to have your cardiac function evaluated. An electrocardiogram, an echocardiogram, and a blood test called NT-proBNP, which is the most sensitive biomarker we currently have for detecting heart failure. The first step is weigh yourself every morning. Actually do it. When you get up, after using the bathroom, before breakfast, with the same clothes or none at all. If the number jumps more than a kilogram overnight, don't wait. Call your doctor. The diuretic dose may need adjusting before that fluid reaches the lungs. Step 2. Sodium. But the real sodium problem, not the salt shaker. Current evidence supports a limit of 1,500 to 2,000 milligrams of sodium per day for heart failure patients. The problem isn't that you're salting your salad. Between 70 and 75% of the sodium we consume comes from processed foods, deli meats, canned goods, sauces, bouillon cubes. 1 packet of instant soup can have 900 milligrams of sodium in a single serving. Read labels. If one serving has more than 140 milligrams of sodium, look for another option. Step 3. Move. Thoughtfully, but move. The leg muscles act as a secondary pump. When they contract, they compress the veins and help push blood back up to the heart. The American Heart Association recommends between 150 and 300 minutes per week of moderate activity for stable heart failure patients. Walking at a decent pace is enough. You should be able to hold a conversation without gasping. If you can't, slow down. One important exception: if your weight spiked that morning, skip exercise that day. Call your doctor first. Listen carefully, because now we're getting to the mistake that cancels out everything we just covered. Over-the-counter anti-inflammatories, ibuprofen, naproxen, diclofenac, are contraindicated in heart failure, not relatively, directly. They block renal prostaglandins, which regulate blood flow to the kidneys. Without them, the kidney massively retains sodium and water. On top of that, they interfere with the diuretics and antihypertensives a cardiologist prescribes. Taking an ibuprofen for knee pain can, in a patient with decompensated heart failure, trigger fluid retention that ends in the emergency room, not over days, sometimes within hours. If you have chronic joint pain and also have heart failure, talk to your doctor about alternatives. Acetaminophen doesn't have this effect on the kidneys. And as you probably know, something many trusted doctors often recommend is the 21-day challenge. I always end these videos with something concrete to do, not more theory. Action. 1. Get a small notebook. Write down your weight every morning, same time, same routine. Not an app, a notebook. 2. This week, open your pantry and read labels on what you regularly eat. Identify the 3 highest sodium items. Just identify them. 3. 15 minutes of walking after your main meal. Not 30, not an hour, 15 minutes. If you're taking on the challenge, write it in the comments. And in 21 days, reply to your own comment with what you noticed. Heart failure doesn't mean the heart stopped. It means it's working beyond its capacity and asking for help. I'm Dr. Dave. If this was useful, share it. See you in the next video.